మామూలుగా చిన్న పిల్లలు పుట్టగానే ఏంటంటే, వాళ్ళ ఏజ్ పెరిగే కొద్దీ కొన్ని కొన్ని యాక్టివిటీస్ వాళ్ళు చేస్తుంటారు. అంటే ఇన్ని మంత్స్‌కి నడవడము, మాట్లాడడము, కొన్ని యాక్షన్స్ ఏస్తుంటారు. కొంతమంది పిల్లలు ఏంటి అంటే, ఒక ఏజ్ వచ్చే వరకు కూడా వాళ్ళు నడవాల్సిన టైంలో కూడా నడవరు అసలు. ఇంకొకటి ఏంటి అంటే ఏదో బిగబట్టినట్టు ఉండడము, టైట్‌గా ఇంకా హ్యాండ్స్ ఒకటి ప్రాపర్‌గా మాట్లాడలేకపోవడం. ఇవన్నీ ఎందుకొస్తాయి? అసలు వాటికి రీజన్ ఏముంటుంది?
So these are children who have cerebral palsy, and it's not a great condition to have. This is something that has happened to them because of very early on in life when the brain is developing. After they are immediately born, sometimes the lack of oxygen to the brain, lack of sugar or glucose to the brain produces some amount of damage inside the brain. And once the brain is damaged, its ability to function in a normal way goes away. It's like if you have your computer motherboard or your mobile phone, if the motherboard is damaged, the kind of performance that your device will give is not going to be that great. So these children are generally kind of disabled in a way in which they are not able to walk. They generally lack good communication skills. The most common problem that these children face is too much of tightness in hands and legs. And if the legs and hands are so tight, they will not be able to do tasks like lifting up objects or walking. We have good solutions for this. The first, foremost, and the best solution for this is to do physiotherapy and exercises on a regular basis. The second option that we have for these children are predominantly surgical. And in surgery, it starts from procedures like rhizotomy, where we tried to reduce the tightness in the legs by doing something with the nerves in the spine. So the brain sends all information to the spinal cord, and spinal cord will send information to the muscles of hands and leg. If the information sent is faulty, it will cause too much of tightness in the muscles. In order to modulate or change the information that the brain is sending to the muscles, we do some kind of surgery where we section out few of the nerves over there. The procedure is called as a selective dorsal rhizotomy. It's a very rare procedure done very recently in India. Previously, it is done quite commonly abroad, but in India the expertise for this procedure is very, very less.
Okay, ఇప్పుడు మీ హాస్పిటల్లో ఇది అవైలబుల్ ఉందా సార్?
Yes, we have been doing it for the last 4 years, and we have treated more than 25 kids with a selective dorsal rhizotomy. The ideal age for this is somewhere between 3 to 6 years of age.
Okay.
And generally it tends not to work beyond that age range. There is another procedure that we do called as an intrathecal baclofen pump, where we put in a device inside the tummy of the baby so that it reduces the tightness in the hands and legs. This improves their quality of life significantly. If they are able to keep their hands and legs relaxed, it becomes easier for them to eat food. It becomes easier for the parents to take them around in the wheelchair. If you're going for a rhizotomy between 3 to 6 years, they are probably going to benefit and improve on their ability to walk.
Okay.
But when we are going for a baclofen pump, probably it's not going to affect their ability to walk so much, but it is going to reduce the tightness in the hands and the legs significantly, especially for the parents who are struggling with their baby for such a long time.
మీరు ఇప్పుడు ఒక డివైస్ యూజ్ చేస్తారు అన్నారు టైట్నెస్ పోవడానికి. అది వాళ్ళు లైఫ్ లాంగ్ యూజ్ చేయాలి?
Yes, in a way the device generally lasts for around 6 years, after which we have to replace the battery again inside. Yes, there is a battery which keeps the medicine flowing inside, which keeps the hands and muscles relaxed. There are different types of devices that are available. The need for the device depends on the child's ability to move the hands and the legs and how tight it is. So it is a subjective thing. The parents can choose not to go for the device further if the child is good enough and has had significant improvement. But in most of the times, once the device is in, it would probably be in throughout the life.
ఓకే సార్, మీరు ఇప్పుడు ఒక పర్టికులర్ ఏజ్ మెన్షన్ చేశారు, 6 years వరకు అని.
బిఫోర్ 6 years.
బిఫోర్ 6 years అని. కొంతమంది పేరెంట్స్ ఏంటి అంటే మామూలుగా ఇంట్లో ఉన్న వాళ్ళు పెద్దవాళ్ళు చెప్తారు 6 years కదా, చిన్నగా మాటలు వస్తాయి, వాళ్ళే నడుస్తారులే అని చెప్తారు, లైట్ తీసుకుంటారు అనమాట ఆ ప్రాబ్లమ్ని. ఒకవేళ 6 years దాటితే ఏమైనా ప్రాబ్లం ఉంటుందా? అప్పుడు మనం ట్రీట్మెంట్ తీసుకోవచ్చు.
So if they are coming after 6 years of age, what happens is that the muscle becomes very atrophic, as in the
Okay.
muscle becomes so thin that even if when we are trying to reduce the tightness in the muscles, still we will not gain some function. Your ability to walk depends on how strong your muscles are there. So if we are doing something to the nerves so that the muscles can perform better, okay, the ability to do that is lost beyond 6 years, because for 6 years the muscles have been getting wrong information, the muscles have not been working, they have become thin and they have become so fragile that even if we change the amount of electricity going to it and we make it much more better, still it's not going to work. And that is why we would like to do the procedure before 6 years and not after 6 years.
ఓకే సార్, ఫస్ట్ స్టేజ్లో డివైస్ అని చెప్పారు, నెక్స్ట్ స్టేజ్లో బ్యాటరీ అని చెప్పారు. బ్యాటరీ కంటిన్యూస్గా అంటే వాళ్ళ ఏ ఏజ్ గ్రూప్ వరకు, ఏ ఏజ్ వరకు అవి డివైసెస్ యూజ్ చేయాలి?
Device can be placed in at any age. It can be continued lifelong. As lifelong for the kids if needed.
Okay, if needed.
If needed. Everybody is different. Everybody's amount of damage to the brain is different, which is causing this kind of hands and legs tightness.
ఇలాంటి సిమ్టమ్స్ మనం ఎప్పుడు స్టార్ట్ అవుతుంది సార్ ఏజ్ గ్రూప్లో?
It is generally diagnosed by the age of around 1.5 year.
ఓకే,
And
ఆ ఏజ్లో ఫైండ్ అవుట్ చేస్తే 1 ఇయర్లో కానీ 1.5 ఇయర్లో కానీ డివైస్ యూజ్ చేయకుండా, ఇలాంటి బ్యాటరీస్ యూజ్ చేయకుండా అవాయిడ్ చేయొచ్చా మనం?
No, the devices and battery would be used predominantly for an older age group and not for the younger age group. For a younger age group, somebody who is diagnosed at around 1.5 year and the parents have noticed that the child is not developing well, not able to walk, there's too much of tightness, the first thing to do would be to take physiotherapy sessions on a regular basis. Sometimes physiotherapy can work as magic, and with physiotherapy, if the child is able to walk and do his activities, then we won't be intervening. It is only when physiotherapy is not working, between 3 to 6 years, we would offer a procedure called a selective dorsal rhizotomy, which does not have any device. It's a one-time procedure where we are simply modulating the amount of electricity that is going to the muscles. After 6 years, when the muscles have become too tight and too thin, we can consider using a pump, that is a baclofen pump, which can be placed anytime, but it is kind of a device which is going to be there lifelong inside them if they want.